Welcome to the Deep Dive, where we give you the shortcut to being well-informed. You know that feeling like butterflies in your stomach before something big, or maybe trusting a gut feeling? Well, what if those phrases are, way more literal than you think? Today, we're taking this really fascinating journey into your gastrointestinal tract, your GI tract. It's that long, twisting tube, right, from your mouth down to, well, the other end. And it's just so much more than simple plumbing for food. It's like this bustling, intelligent ecosystem. People even call it our second brain.
That's exactly right. And our mission today is to pull out the really key insights from a whole stack of sources. We're covering the basics of the GI system, sure, but also common things like heartburn, bloating.
Things we all kind of experience.
Exactly. And then digging into more complex stuff like IBS, IBD, and the absolute incredible world of your gut microbiome. Basically, we want to give you a clear understanding, packed with surprising facts, practical takeaways, without you having to read all the dense research yourself.
Okay, yeah, let's unpack this then. So starting with the absolute basics, when we say GI tract, what are we actually talking about?
Right. So essentially, it's a series of hollow organs, like your mouth, esophagus, stomach, the small intestine, then the large intestine, which, yeah, we often call the colon, the rectum, and the anus.
Okay.
But you can't forget the accessory organs, too. They're crucial.
Yeah.
Your liver, pancreas, gallbladder, they all play a big part. It really is a marvel of biological engineering when you look at it.
And it's doing more than just breaking down food, isn't it?
Oh, way more. Yeah. Beyond just digestion, its main jobs are absorption, that's pulling vital nutrients into your bloodstream.
Got it.
Motility, that's basically how food and waste keep moving through the system. And finally, excretion. Getting rid of waste. All these things are really tightly linked.
Okay, here's something that I found really surprising. Yeah, how long does this whole thing actually take? From eating something to, well, completion. It's not quick, is it?
No, definitely not. You're right. It's a marathon, not a sprint. Typically, it takes anywhere from 24 to maybe 72 hours.
Wow, 72 hours.
Yeah. Food usually gets out of your stomach in about 2 to 6 hours. Then it spends another 2 to 6 hours moving through the small intestine. But then it can spend a long time, like 36 hours or even more, just in the large intestine.
36 hours.
And that slow journey, well, it's crucial for a very important reason.
And I'm guessing that reason probably brings us to this thing scientists are calling the forgotten organ.
Precisely. Yeah, the forgotten organ. While we usually just think about the food passing through, your intestines, especially the colon, they're home to this vast, incredibly complex community.
Yeah.
Trillions of bacteria, viruses, fungi.
Trillions.
Trillions. This is your gut microbiome. And its influence is just so profound. Its health is absolutely essential, not just for digestion, but for your immune system, even your mental well-being. It's this whole internal world that honestly really deserves our attention.
An entire inner world. A forgotten organ. That's powerful. Can you maybe help us picture how, dense and diverse this microscopic world actually is? What does that inner rainforest really look like?
Yeah, inner rainforest is a great analogy. Imagine this thriving, incredibly dense ecosystem, but it's miniaturized and living inside you. Your gut microbiome, it's this collective community, trillions of microorganisms mostly hanging out in your large intestine.
Okay.
And the really amazing part, the vast majority of them are beneficial. They live with us in this symbiotic relationship. It helps them, it helps us. They're not just, passive residents. They're doing critical work for us.
So these tiny tenants, they aren't just freeloading. What are some of their most important jobs then?
Oh, their job description is pretty impressive. For starters, they're like master digesters and nutrient factories. They ferment complex carbs, like fiber, that our own bodies just can't break down.
Right, like fiber.
Exactly. And in doing that, they produce these vital compounds called short-chain fatty acids, SCFAs, like butyrate. And here's a really cool insight. These microbes don't just help us digest, they actually feed our own gut cells. Butyrate is like the main fuel keeping your colon cells healthy and strong.
Wow, they make fuel for our own cells.
They do. And they also synthesize essential vitamins, vitamin K, several B vitamins like B12, thiamine, riboflavin, stuff we need for everything from energy to nerve function.
So they're like little internal vitamin factories too.
Yeah.
But it doesn't stop there, does it? Their influence goes further.
Not at all. Another huge role. They're basically your immune system's boot camp. Did you know something like 70% of your entire immune system is located in your gut?
70%. That's huge.
It is. And your microbiome acts like a trainer. It teaches your immune cells to tell the difference between friend and foe, good guys, bad guys. This helps reduce your risk of infections and maybe even autoimmune conditions. And they also act as the guardian of your gut wall.
Guardian. How so?
They strengthen that really critical barrier lining your gut. It's only one cell thick, believe it or not.
Wow.
So if that barrier gets compromised, we call that leaky gut. It can potentially lead to widespread inflammation all over your body.
Okay, so they're helping immunity, protecting the gut wall.
Yeah.
It sounds like they must be connected to our brain too, right? That whole second brain idea.
Absolutely. You nailed it. They're essentially the second brain's conductor. Your gut gets called the second brain because it has its own independent nervous system. It's this complex network, like 100 million neurons down there.
100 million.
Mm-hmm. And what's really incredible is that your gut microbes are major players in this gut-brain conversation. They produce hundreds of neurochemicals. For instance, get this, over 90% of your body's serotonin.
The feel-good chemical.
Exactly. That feel-good neurotransmitter that regulates mood, sleep, appetite. Over 90% is made in your gut, largely influenced by these microbes.
That explains so much, like why stress messes with your digestion or why gut problems can affect your mood.
Precisely. It's a very real, very powerful connection.
It sounds like such a finely tuned, delicate system, though. What are the common things that can really throw this balance off, cause that dysbiosis you mentioned?
Right, dysbiosis. That's when the ecosystem gets unbalanced. Maybe harmful microbes start to outnumber the good guys, or the overall diversity just plummets.
Yeah.
The main culprits. Well, diet is a big one. Diet's high in processed foods, lots of sugar, unhealthy fats.
The typical Western diet, basically.
Pretty much, yeah. Overusing antibiotics is another huge factor. They're sometimes necessary, of course, but they can act like a nuke in the gut, wiping out good bacteria along with the bad.
Okay.
Then there's chronic stress, poor sleep, and importantly, not getting enough dietary fiber that's the food for your good microbes.
And for us, the listeners, what does it actually feel like or look like when our inner world has this dysbiosis? What are the signs?
Well, the consequences can be pretty broad. You might notice digestive issues, first things like bloating, gas, maybe constipation or diarrhea, but it can go beyond the gut.
Mm-hmm.
We often see links to chronic inflammation throughout the body, a weakened immune system, skin problems like eczema or acne, and even an increased risk for bigger conditions like obesity, type 2 diabetes, and potentially even some neurological disorders down the line. It's basically your gut sending out signals that something's not right.
Okay, let's shift from the microscopic to maybe the more familiar discomforts lots of us deal with, like that burning feeling rising up from your stomach into your chest, your throat, heartburn. Most of us have felt that. That's acid reflux, right?
Exactly. And the mechanism behind it, it really comes down to this gatekeeper. It's called the lower esophageal sphincter, or LES.
LES, okay.
Right. Think of it like a really important one-way door. It separates your stomach, which is full of strong acid, from your esophagus, which is much more delicate.
Makes sense.
So, as Dr. Eleanor Finch apparently put it, when that gate is left ajar, trouble begins. When this LES weakens, or maybe it just relaxes when it shouldn't, that stomach acid can splash back up, and that's what causes the burn.
So what makes that gatekeeper, the LES, weaken or relax like that?
Well, diet definitely plays a role. Things like really rich, fatty foods, they slow down digestion. Spicy foods can irritate. Acidic things like tomatoes, citrus, even chocolate, peppermint, caffeine, alcohol, they're known to relax the LES muscle itself.
Oh, okay.
And carbonated drinks can increase pressure too, but it's not just food. Lifestyle factors matter a lot, like overeating or lying down too soon after you eat. Carrying extra body weight puts pressure on the stomach. Smoking is a big one. Nicotine relaxes the LES.
Right.
Even things like tight clothing or just chronic stress can make it worse. You know, that quote from nutritionist Mark Davison seems apt. Heartburn is often a conversation your body is trying to have with you about your choices.
That's a good way to think about it. And it's important to note, right, if you're getting heartburn like 2 or more times a week regularly, it could actually be GERD, gastroesophageal reflux disease.
Yes, exactly. GERD is the more chronic, persistent form, and it's important to get it checked out because it can lead to more serious issues if it's not managed.
Okay, next up, bloating. The bloat belly conundrum, as some call it, that feeling of fullness, pressure. Sometimes you can even see it, right? The food baby. And it's crucial to understand this isn't the same as gaining fat or retaining water, is it? It's specifically about trapped gas or pressure in the GI tract.
That's exactly right. And when you dig into the root causes, it almost always boils down to one of two things. Either you're producing excess gas, or the movement of your digestive muscles is somehow disturbed, trapping the gas that's there.
So what are the usual suspects for causing that uncomfortable pressure?
Well, dietary triggers are really common,
Mm.
cruciferous veggies, broccoli, cauliflower,
The
cabbage,
healthy stuff?
often the healthy stuff, yeah. Legumes, beans, lentils, onions, garlic. Artificial sweeteners can do it. And dairy, of course, for people with lactose intolerance. These foods often contain specific types of carbs or fibers that are hard for our small intestine to digest.
So they end up fermenting later on.
Exactly. They reach the large intestine relatively intact, and the bacteria there have a feast, producing gas as a byproduct. But it's also how you eat. Swallowing air if you eat too fast, talk while chewing, chew gum, drink fizzy drinks, or use a straw that can contribute to.
Oh, okay.
And then there's your microbiome again, an imbalance like dysbiosis or a condition called SIBO, intestinal bacterial overgrowth, where bacteria end up in the small intestine where they shouldn't be in large numbers. That can cause a lot of gas. And don't forget constipation. If things aren't moving through, it's like a traffic jam, right? Gas gets trapped behind the backup.
Makes sense. Like Dr. Eleanor Vance said, bloating isn't just noise, it's a signal.
It really is. It's telling you something.
And if it's persistent, really bothersome bloating, it could potentially point to something more, like maybe a food intolerance, celiac disease, IBS, hormonal shifts, or even gastroparesis.
Yes, persistent or severe bloating definitely warrants a conversation with your doctor to rule out underlying conditions.
Okay, now for the tale of two toilets, as our notes call it. Diarrhea and constipation. They're like polar opposites, these signals from the gut.
They really are. If you think of digestion as that assembly line, diarrhea is when the line speeds way up, and constipation is when it grinds almost to a halt.
So what's the core difference in terms of what's happening inside?
It really comes down to speed and water balance. With diarrhea, you've got loose, watery stools, usually 3 or more times a day. That happens because waste is moving through the colon too quickly, so there isn't enough time to absorb the proper amount of water.
Too fast, okay.
Right. And with constipation, it's the opposite. Fewer than 3 bowel movements a week, typically, and the stool is hard, dry, difficult to pass. That's because the waste is moving too slowly and the colon absorbs too much water.
So what typically makes the system speed up and cause diarrhea?
Often it's infections. Viruses like norovirus or bacteria from food poisoning, sometimes parasites. Certain medications, especially antibiotics, can disrupt the gut flora and cause it. Food intolerances or allergies are common triggers too, and conditions like IBS-D, Crohn's, ulcerative colitis, even stress and anxiety can trigger diarrhea for some people.
And on the flip side, what usually causes that digestive slowdown? Constipation.
Constipation is very often linked to lifestyle factors. A diet low in fiber is a big one, not drinking enough fluids, lack of physical activity. Certain medications are known culprits too, things like opioids, iron supplements, some antidepressants, even some antacids. Also, just ignoring the urge to go can contribute over time. And then there are underlying conditions like IBS-C or hypothyroidism or other medical issues.
So the approach to managing them is completely opposite then.
Pretty much. For diarrhea, the focus is usually on hydration, replacing lost fluids and electrolytes, and sticking to bland, easy-to-digest foods for a bit, like the brat diet, bananas, rice, applesauce, toast. For constipation, it's often about gradually increasing fiber intake, drinking more water, and getting more physical activity to help stimulate bowel movements.
Okay, that makes sense. Sometimes, though, these gut signals aren't just temporary issues, right? They point towards more chronic conditions that need, well, a deeper understanding. Let's talk about irritable bowel syndrome, IBS. We hear that term a lot. Is this second brain going haywire? And how is it different from IBD?
Yeah, IBS is definitely where that gut-brain communication seems to go off track. And this is really crucial, IBS is not the same as IBD, inflammatory bowel disease. IBS is what we call a chronic functional gastrointestinal disorder.
Functional.
Meaning there's no visible inflammation, no ulcers, no damage to the bowel tissue that we can see with stopes or tests. The structure looks normal, but the function is off. Someone once described it like a beautifully designed orchestra where the musicians are playing off-key and out of sync. The instruments are fine, but the coordination is messed up.
Okay, so if there's no actual damage, what are the symptoms that people with IBS experience?
The core symptoms usually include abdominal pain or cramping, and this pain is often related to bowel movements. Maybe it gets better after going. Then there's bloating, gas, and changes in bowel habits. And those changes define the subtypes. IBSD means diarrhea is a predominant, IBSC means constipation is, and IBSM is a mix of both.
And it's often unpredictable, right?
Very unpredictable. That's one of the hardest parts for people living with it. The symptoms can fluctuate, come and go, change over time. It makes life difficult.
So if it's functional, what's actually causing this internal chaos? Is it just stress?
Stress is definitely a major factor, but it's usually more complex than just that. The gut-brain axis is absolutely central. Stress, anxiety, depression, they can definitely trigger symptoms or make them worse. Remember that quote, "What happens in the gut does not stay in the gut."
Yeah, from Dr. Fasano.
Exactly. It highlights that deep connection. Other factors involved can include something called visceral hypersensitivity, basically. The gut is just extra sensitive to normal sensations like gas or contractions. Altered gut motility plays a role. The contractions might be too fast, leading to diarrhea, or too slow, causing constipation. Gut microbiome imbalance, or dysbiosis, is often seen in IBS too. And sometimes IBS can actually start after a bad bout of gastroenteritis, like food poisoning. We call that post-infectious IBS.
So there's no single magic bullet cure then. How is IBS usually managed?
No cure, unfortunately, but management is definitely possible, and it usually requires a really personalized approach. Dietary strategies are common. The low FODMAP diet is one you hear about, but it's quite restrictive and should really be done with guidance from a dietitian or doctor.
Right. Not something to just try on your own.
Definitely not long-term without guidance. Stress management is huge. Things like yoga, meditation, cognitive behavioral therapy, CBT, can be very effective. Lifestyle adjustments like regular gentle exercise and prioritizing sleep help too. And then there are specific medications that can target symptoms like pain, diarrhea, or constipation.
Okay, now let's contrast that with inflammatory bowel disease, IBD. You were clear they're different. You called IBD the unseen battle within. What makes it so different?
That's a good way to put it. The key difference is inflammation and damage. IBD is a term for chronic autoimmune disorders. This means the body's own immune system mistakenly attacks the GI tract. This causes prolonged, significant inflammation that actually damages the bowel tissues. It's not just a functional issue like IDS. There's real physical harm occurring.
Autoimmune. So the body's attacking itself.
Essentially, yes, and this makes it a much more serious condition than IBS.
What are the main types of IBD?
There are two main forms, ulcerative colitis, or UC, and Crohn's disease.
Okay, UC and Crohn's. How do they differ?
Ulcerative colitis is generally confined to the large intestine, the colon, and the rectum. The inflammation is usually continuous, starting from the rectum and extending upwards, and it typically only affects the innermost lining of the bowel wall, the mucosa. Hallmark symptoms are often bloody diarrhea, a sense of urgency to go, and abdominal pain.
And Crohn's disease?
Crohn's disease is different because it can affect any part of the GI tract, literally from the mouth all the way down to the anus, although it most commonly affects the end of the small intestine and the beginning of the colon. The inflammation in Crohn's is often patchy, meaning there can be diseased areas right next to healthy areas. We call these skip lesions. And crucially, the inflammation can penetrate the entire thickness of the bowel wall, not just the lining.
Wow, that sounds like it could lead to more complications.
It can. Things like strictures, which are narrowings of the bowel, or fistulas, which are abnormal tunnels connecting the bowel to other organs or the skin. Symptoms of Crohn's often include abdominal pain, diarrhea, which might be bloody but not always as consistently as in UC, significant weight loss, and fatigue.
So the impact of IBD isn't just limited to gut symptoms then?
No, not at all. Because it's driven by systemic inflammation, IBD can affect the whole body. People often experience profound fatigue, joint pain or arthritis, skin rashes, eye inflammation, fever. In children, it can even lead to delayed growth.
How is IBD diagnosed and treated?
Diagnosis usually involves a combination of things. Blood tests, stool tests to check for inflammation markers or infections. Endoscopy and colonoscopy are really the gold standard, allowing doctors to directly see the inflammation and take biopsies for confirmation. Imaging like MRI or CT scans might also be used. As for treatment, there's no cure yet, but the goal is to control the inflammation, induce and maintain remission, and prevent complications. This involves medications like anti-inflammatories, immune system suppressors, and newer biologic therapies that target specific inflammatory pathways. Diet and lifestyle play a role in management too, and sometimes surgery is necessary.
Okay, one more common issue before we move on. Let's talk about hemorrhoids. Bit of a sensitive topic maybe, but incredibly common. You called it a real pain in the, well,
Yes. Very common.
And here's what surprised me. The fact that everyone actually has hemorrhoids normally, they're just these cushion-like vein clusters.
That's the key insight. Exactly. They're a normal part of our anatomy down there in the rectum and anus. They only become a problem, what most people mean when they say they have hemorrhoids, when those veins become swollen and inflamed. It's very similar to how varicose veins develop in the legs.
Ah, okay. Like varicose veins of the area.
Pretty much. As Dr. Alistair Finch apparently described it, don't think of them as a disease, but as normal anatomy that's become problematic, usually due to pressure and strain. And they come in two main types. Internal hemorrhoids, which are deep inside the rectum. You usually can't see or feel them, and they're often painless. The main sign might be bright red blood on the toilet paper or in the bowl after a movement. Sometimes they can prolapse, meaning they bulge outwards. Then there are external hemorrhoids, which form under the skin right around the anus. This area has a lot more pain-sensing nerves, so these are the ones that tend to cause pain, itching, swelling, and discomfort. If a blood clot forms inside one, it's called a thrombosed hemorrhoid, and that can be extremely painful.
Ouch. So what causes all that pressure that makes them swell up?
The absolute #1 cause is straining during bowel movements. This often happens because of chronic constipation, trying to pass hard stools, but chronic diarrhea can also irritate and strain the area.
So both extremes are bad.
Yes. Other major culprits include prolonged sitting, especially spending too much time sitting on the toilet. Pregnancy puts a lot of pressure on that area. A diet low in fiber makes constipation more likely, which leads to straining. Heavy lifting, obesity, and even just the effects of aging can contribute by weakening the tissues.
The good news, though, is that most of the time, these are manageable at home, right?
Absolutely. For many people, simple measures make a big difference. #1, embrace fiber. Aim for about 25 to 35 grams per day from food or supplements to keep stools soft and easy to pass. Stay well hydrated, drink plenty of water. Warm baths or sitz baths can be very soothing. Practice healthy bathroom habits. Go when you feel the urge. Don't strain or push hard, and try not to linger on the toilet. Over-the-counter creams or suppositories can help with symptoms like itching and swelling, too.
But when should someone see a doctor?
Definitely see a doctor if your symptoms don't improve after about a week of home care, if the pain is severe, or if there's significant bleeding. It's important to get a proper diagnosis and rule out other things. There are medical treatments available too, ranging from simple in-office procedures like rubber band ligation to injections, coagulation therapies, or sometimes surgery for very persistent or large hemorrhoids.
Okay, so we've covered a lot, from the basic plumbing to the microbiome, common discomforts, and chronic conditions. What does this all really mean for you, the listener? It sounds like we actually have quite a bit of power to influence our gut health.
You absolutely do. It's really empowering when you realize that. Nurturing your inner garden, your microbiome, it starts with pretty straightforward, consistent choices. First off, you got to feed your friends down there.
Feed the good guys.
Exactly. Think probiotics as the seeds. These are the live beneficial bacteria. You find them in fermented foods like yogurt with live cultures, kefir, real sauerkraut, kimchi, and then you need prebiotics, which are like the fertilizer. These are types of indigestible fibers that your good bacteria love to eat. You find them in things like garlic, onions, leeks, asparagus, bananas, oats, beans.
So probiotics add seeds, prebiotics feed them. Makes sense.
And diversity is key. Don't just eat the same few things.
Right, that's where Eat the Rainbow comes in. Aiming for, 30 different plant types a week? That sounds like a lot. But it includes fruits, veggies, whole grains, nuts, seeds, even herbs and spices. It all counts towards feeding a wider variety of those beneficial microbes.
It really does. And beyond diet, you have to manage stress. We talked about that powerful gut-brain connection. Chronic stress pumps out cortisol, which can increase gut permeability, that leaky gut issue. So practices like mindfulness, deep breathing, gentle exercise, even just spending time in nature, they all help.
Yeah, and prioritize sleep. That seems crucial for everything.
It really is. Poor sleep messes up your microbiome's natural rhythm. Aim for that sweet spot of 7 to 9 hours. And hydrate. Water is just fundamental for breaking down food, absorbing nutrients, keeping things moving to prevent constipation, and maintaining that important gut lining.
Don't forget movement.
Absolutely. Move your body mindfully. Regular, moderate exercise is fantastic. It actually increases bacterial diversity in the gut, helps with regularity, and it's another great stress reducer.
Okay, so lots we can do. But finally, sometimes, even with the best efforts, we need a clearer picture of what's actually going on inside, right? And medical science has some pretty incredible tools for that.
Definitely. This is where procedures like endoscopy become really valuable. It sounds maybe a bit intimidating, but it's a non-surgical procedure where a doctor uses an endoscope.
Which is like a thin tube with a camera.
Exactly, a thin, flexible tube with a tiny camera and a light on the end. It allows them to look directly inside your digestive tract. As Dr. Anya Sharma apparently put it, think of an endoscope as our eyes inside the body.
And there are different kinds, depending on what they need to see.
Yes. An upper endoscopy, sometimes called an EGD, looks at the esophagus, stomach, and the very first part of the small intestine. That's often used for investigating things like severe, persistent heartburn, trouble swallowing, or stomach pain.
Okay.
Then there's colonoscopy, which examines the entire large intestine, the colon, and the rectum. This is incredibly important not just for investigating symptoms, but it's the gold standard for colorectal cancer screening.
Because they can find polyps, right?
Precisely. They can find and actually remove potentially precancerous polyps during the very same procedure. That's huge for prevention. Current guidelines generally recommend average risk individuals start screening at age 45.
Age 45 now. Okay. And what about the small intestine? That seems harder to reach.
It is. For looking at the small intestine, there's capsule endoscopy. It's pretty cool. You actually swallow a capsule about the size of a large vitamin pill that contains a tiny camera. It takes thousands of pictures as it travels through your digestive system, especially focusing on the small intestine.
Wow. So what's the experience like for these procedures? People worry about discomfort.
Understandably. But preparation is the main thing, usually fasting beforehand. And for a colonoscopy, there's a bowel prep involving laxatives to clean everything out. During the actual procedure, you'll typically receive sedation. It's often called twilight sleep. You're comfortable, relaxed, maybe drowsy, and most people don't remember the procedure afterwards.
So you're comfortable and probably won't remember it.
Exactly. They're generally very safe procedures and usually quite quick. The examination itself might only take 15 to 45 minutes, depending on the type. The main thing is you'll need someone to drive you home afterwards because of the sedation.
And it's not just about looking, is it? They can actually do things during an endoscopy.
Oh, absolutely. That's a major advantage. They can take tiny tissue samples called biopsies to test for various conditions. They can remove polyps, as we mentioned, that's called a polypectomy. They can stop areas of bleeding or even stretch open areas that have become narrowed, called dilation. So it's a powerful diagnostic and therapeutic tool. It can provide answers and treatment all in one go.
So wrapping this all up, what's the big takeaway here? It seems like our GI tract is way more than just plumbing. It's this incredibly complex, intelligent system influencing almost everything.
That's really the core message. Your gut profoundly influences not just how you digest your food, but your immune system's strength, your mood, your energy levels, your overall long-term health and well-being. It's deeply interconnected.
Yeah, and we've seen how those common discomforts, the heartburn, the bloating, the bowel issues, they often signal some kind of imbalance or issue within this really delicate ecosystem.
Exactly. And understanding those signals empowers you, right? It helps you know when simple changes might be enough, nurturing your microbiome with diverse foods, managing stress better. And it also helps you know when it's time to seek medical help, maybe for persistent symptoms or for important screenings like colonoscopy. You really do have the power to make a difference.
So we definitely encourage you, listen to your gut. Literally. It
Yeah.
really does have a lot to tell you.
And maybe here's a final thought, something provocative for you to just mull over. Given how intimately our gut health seems to influence our mood, our thoughts, maybe even our decisions, what's just one small, consistent change you could commit to making this week to actively nurture your own inner ecosystem?
Just one small thing.
Yeah, just one thing. And then maybe think about how that small change done consistently might ripple outwards. How could it potentially transform more than just your digestion? How might it impact your energy, your mood, your entire sense of well-being? Something to think about.